Social Determinants of Health, Individual Health Practices and Coping Skills. RPN Safe Practice Completion Program, Sheridan College, partnering with vulnerable populations. What are the social determinants of health? The social determinants of health are the social and economic factors that influence people's health. These are apparent in the living and working conditions that people experience every day. The social determinants of health influence health in many positive and negative ways. Extreme differences in income and wealth, for example, have negative health consequences for those who are living in poverty. And these effects are magnified when these people are congregated in poor regions. In contrast, those who are well off and living in well-off regions have better overall health. Social determinants of health influence health positively and negatively. This variation among individuals and groups due to income is referred to as the social gradient. The social gradient illustrates that higher income levels result in better health outcomes, where lower income levels result in poorer health outcomes. Even in affluent countries such as Canada, the social gradient exists, but is often masked by the high levels of overall population health status. The social gradient not only represents the effects of income on health, but also the importance of income as a means of gaining access to other social determinants of health, such as education, food, housing, recreational activities, and other societal resources. One of the major social determinants of health is personal health practices and coping skills. Personal health practices and coping skills refer to those actions by which individuals can prevent diseases and promote self-care, cope with challenges, and develop self-reliance, solve problems, and make choices that enhance health. Definitions of lifestyle include not only individual choices but also the influence of social, economic, and environmental factors on the decisions people make about their health. There is a growing recognition that personal life choices are greatly influenced by the socio-economic environments in which people live, learn, work, and play. These influences impact lifestyle choice through at least 5 areas: personal life skills, stress, culture, social relationships and belonging, and a sense of control. Coping skills, which seem to be acquired primarily in the first few years of life, are also important in supporting healthy lifestyles. These are the skills people use to interact effectively with the world around them, to deal with the events, challenges, and stress they encounter in their day-to-day lives. Effective coping skills enable people to be self-reliant, solve problems, and make informed choices that enhance health. And these skills help people face life's challenges in positive ways. Ineffective coping, on the other hand, are people's inability to assess a stressful situation or event comprehensively and, as a result, fail to make sound decisions using inappropriate resources, and resort to risky behaviors such as smoking, alcohol or drug abuse, physical inactivity, and poor nutrition. Many so-called risk behaviors may, in fact, be coping strategies for stress and strain caused by living circumstances. For example, considerable evidence indicates that people living in poverty use smoking as a coping strategy. In the 2017 survey from Statistics Canada, the overall prevalence of smoking was 15.1%, equivalent to approximately 4.6 million Canadians. This represents a significant increase from the 2015 estimate of 13%. According to the report of the National Population Health Survey and the Canadian Mortality Database, tobacco use remains the leading preventable cause of death and disease in Canada. For every person who dies from smoking, another 20 continue to suffer from at least one serious tobacco-related illness, such as coronary heart disease, lung diseases, and cancers. But this burden is overrepresented in more vulnerable populations. Vulnerable populations are those who are likely to develop health problems because of excessive risks, who experience barriers when trying to access healthcare services, or who are dependent on others for care. Examples of vulnerable populations are people who live in poverty, who are homeless, who live in precarious circumstances, such as women in abusive interpersonal relationships, people with chronic conditions and disabilities, who engage in stigmatizing risk behaviors, including substance abuse and unsafe sexual practices, as well as indigenous people, new immigrants, and refugees. Individuals and their families often belong to more than one of these groups and may live in communities that can be characterized as vulnerable. Frequently, clients in vulnerable circumstances come from a variety of cultures, have beliefs and values different from the mainstream culture, face language barriers, and have few sources of social support. Vulnerable populations, such as those raised in poverty, develop thought patterns, social interactions, and cognitive strategies that they frequently carry into adulthood. For example, an individual was raised in poverty and lives in a stressful and impoverished living conditions. Because of this, that person constantly has feelings of shame, insecurity, and worthlessness. When faced with adversity, daily life can appear unpredictable, uncontrollable, and meaningless. Uncertainty about the future causes anxiety and hopelessness, which adds to exhaustion and complicates day-to-day coping. They are also frequently stressed and attempts to alleviate stress by engaging in unhealthy coping behaviors such as smoking. Poverty and poor health worldwide are inextricably linked. Poverty is both a cause and a consequence of poor health. Poverty increases the chances of poor health. Poor health, in turn, traps communities in poverty. This vulnerable population's health is often worst affected, deprived of the information, money, or access to health services that would help them prevent and treat disease. The cost of doctors' fees, a course of drugs, and transport to reach a health center can be devastating, both for an individual and their relatives who need to care for them or help them reach and pay for treatment. In the worst cases, the burden of illness may mean that families sell their property, take children out of school to earn a living, or even start begging. Furthermore, overcrowded and poor living conditions can contribute to the spread of airborne diseases such as tuberculosis and respiratory infections such as pneumonia. Reliance on open fires or traditional stoves can lead to deadly indoor air pollution, and a lack of food, clean water, and sanitation can also be fatal. Nurses play critical roles in reducing poverty and its impact on health and well-being by monitoring, alleviating, and preventing family poverty, bringing about social change, working with poor families, and helping them develop personal skills. Through monitoring, nurses can serve as the poor's eyes and ears, giving voice to the effects of poverty on health. For example, to track how specific policies affecting children and families, such as childcare, housing, social assistance, employment, taxation, and so on. Data collected by public health nurses in their monitoring role can help validate existing research on the impact of poverty and related public policies on child or family health and identify the need for additional research. Nurses' monitoring efforts also serve as the foundation for reducing and preventing family poverty. These roles activities are geared toward assisting families in alleviating or minimizing the effects of poverty. Most of these initiatives aim to improve or expand access to services for low-income families. Informing parents about health and social services and programs, for example, is an important part of the daily work of public health nurses. Furthermore, by facilitating the establishment and operation of community gardens, community kitchens, and early childhood development initiatives, public health nurses can assist poor families in alleviating the effects of poverty. Public health nurses play an important role in bringing about social change in order to alleviate poverty. Nurses, for example, can start a public conversation about the health consequences of poverty and how policies like low social assistance rates, and a lack of subsidized childcare can trap families in poverty. They can assist local anti-poverty organizations, put family poverty on their professional organizations' agendas, and raise awareness through the media. Health regions could use the information gathered by nurses through monitoring activities to advocate for healthy public policies with appropriate government levels and private sector organizations, to support community groups that advocate for these policies, and to inform the public about the impact of poverty on family health through the media and other forms of communication. Because of their size, organizational infrastructure, political connections, and knowledge, nursing organizations are uniquely positioned in this regard. One such organization is the Registered Nurses Association of Ontario, which has worked to influence policy in areas such as homelessness, social exclusion, inadequate welfare support, and minimum wages. Teamwork is the key to success in developing frontline nurses' capacity to address family poverty. The idea that teams, not individuals, are the fundamental learning unit in an organization, and that the most successful learners use collective strategies that include co-learners, such as colleagues, staff, supervisors, and clients. In conclusion, individual behavior plays an important role in health outcomes. By providing health education and social support, an individual can develop personal skills, enhance coping strategies, and gain control over their health and environments so that they can make healthy lifestyle choices. Positive changes in individual behavior can then result to the reduction in the rates of chronic diseases in the country. The end. Thanks for watching. Social Determinants of Health, Individual Health Practices and Coping Skills.